Auzubillahiminash-shaytanir-rajim. Bismillahir-Rahmanir-Rahim. In this small clip, I would be reminding my students about ptosis from the clinical point of view. There are four main measurements which we perform in a patient who comes with the drooping of upper eyelid, which is called ptosis. Number one, we measure MRD, which stands for marginal reflex distance. We show light into the eyes of the patient, and with a transparent ruler we measure the distance between upper eyelid margin and that corneal reflex of the torch. Normally it is 4 to 4.5 millimeter. Number 2, we measure the distance between the upper eyelid and the lower eyelid. It is called vertical fissure height in the center with the transparent ruler. It is normally 10 to 12 millimeter. Number 3, we measure the upper eyelid crease. We ask the patient to look down and we measure this crease with the help of the transparent ruler between the upper eyelid crease and the upper eyelid margin. Normally it is 8 to 10 millimeter. And fourth and the most important measurement is the measurement of the function of the levator palpebrae superioris muscle. The test is called upper lid excursion test. It's difficult for me to demonstrate here, but we somehow place the thumb on our eyebrow like this, ask the patient to look down as much as he can. We place a point of the ruler, say 1 on the ruler, and we ask the patient to look as up as he can, and we measure the distance between the lowest and the highest elevated point. And the reason of placing the thumb is to negate the function of the frontalis muscle so that the patient may not use his frontalis muscle. Usually the distance between the lower and the upper eyelid, that is the it is a distance which the levator muscle has covered is normally should be more than 15 millimeter. So these are the four important measurements apart from other tests like visual acuity, obviously extraocular muscles, cover and cover tests, although they are related to squint, but in the case of ptosis also, and myopia assessment. But these are the four main tests which are exclusively done only to assess the ptosis. Thank you and hope to see you in the next video.